Hi, this is Dr. Urbi.Ghosh, and this is Proteins Lecture Part 4. In this particular lecture, we will explore the topic of how much proteins should we eat. Consuming adequate amount of proteins, such as for athletes, is a major concern for many people. But this concern is primarily not so much in the American population, and it's quite unnecessary since we can easily consume the protein our bodies need by eating an adequate and a diet full of variety of foods. However, there is a highly specialized way of knowing whether or not there's enough nitrogen or protein in your diet, and this is done through a measurement called nitrogen balance. As I said, it's a highly specialized procedure which is used to determine a person's protein needs. Now, nitrogen is usually excreted through the body's process of recycling or using proteins. Thus, the balance can be used to estimate whether protein intake is adequate to meet the protein needs. Now, typically, nitrogen balance is performed only in experimental laboratories, and it measures basically how much nitrogen we intake or consume in protein versus how much we excrete through urine. Now, typically this is performed in a procedure for over 2 weeks in which both nitrogen intake and nitrogen excretion is measured in the laboratory. What happens is patients are fed a standardized diet, the nitrogen content of which has been measured and recorded and is fed to the study participant. The person is required to consume all the foods provided. Because of the majority of nitrogen is excreted in the urine and feces, laboratory technicians directly measure the nitrogen content of the subject's urine and fecal samples. Now, there are small samples of nitrogen which are excreted in the skin, the hair, and the body fluids, and such as mucus and semen, but because of the complexity of collecting the nitrogen excreted via these routes, the measurements are estimated. Thus, technicians add the estimated nitrogen losses to the nitrogen measured in the subject's urine and feces, and nitrogen balance is calculated, and there's a difference between nitrogen intake and the nitrogen excretion. People who consume more nitrogen than is excreted is seen here in the blue. It's more consumption than excretion. Are thought to be in positive nitrogen balance. This state indicates that the body is retaining and adding protein, and it occurs during periods of growth, pregnancy, or recovery from illness or a protein deficiency. People excrete more nitrogen, here in orange, is thought to have a negative nitrogen balance. And this situation indicates that the body is losing protein here. And it occurs during starvation or when people are consuming very low energy diets. This is because when energy intake is too low to meet energy demands over a prolonged period of time, the body metabolizes the proteins for energy, and nitrogen from these proteins is excreted in the urine or feces. Negative nitrogen balance also occurs during severe illness, infection, high fever, serious burns, or injuries that causes significant blood loss. People in these situations require increased dietary protein. A person is in nitrogen balance when the nitrogen intake or consumption is equal to the nitrogen excretion. This indicates that protein intake is sufficient to cover protein needs, and healthy adults are not pregnant or in nitrogen balance. So how much protein does one need? Well, if you want to know, most adults need about 0.8 kilograms of body weight per day. Now, of course, if you are a strength trainer, athlete, or endurance athlete, your levels of protein intake, of course, obviously will go up. So the recommended daily for a sedentary person is 0.8 grams per kilogram of body weight. The recommended percentage of energy that should come from protein is about 10 to 35% of the total energy intake. Protein needs are higher for children, adolescents, and pregnant lactating women because more protein is needed during times of growth and development. Protein needs can also be higher for active people and for vegetarians as indicated on this chart. Most Americans meet or exceed the RDA of the dietary protein, and many foods besides meat can be good sources of protein, including dairy products, legumes, eggs, and nuts, and whole grains. Now, in this table, we see the protein content of commonly consumed foods. And although most people think that the only good sources of protein are meats, such as beef and pork and poultry and seafood, many other foods are also rich in proteins. And these include the dairy products, such as milk, cheese, and yogurt, soy products, eggs, legume, including soy products, whole grains, as well as nuts. Nuts are a big source of protein as well. Fruits and many vegetables are not particularly high in protein. However, these foods provide fiber, and many vitamins and minerals are excellent sources of carbohydrates. Thus, eating them can provide carbohydrates and energy you need in the body to use protein to build and maintain tissue. How can vegetarian diets provide protein? Well, in vegetarian diets, of course, you restrict the diet to foods of plant origin. And there are many varieties and versions of being vegetarian. And of course, there are many reasons to adopt a vegetarian diet. Here is a nice screenshot of different types of vegetarians that can be found. And each of these different categories, although they all consume vegetables, some will consume also other things such as dairy products and some seafoods. So different diets, different varieties of being vegetarian. So why do people become vegetarian? People can choose to become vegetarian for a variety of reasons. Health benefits, they feel that consuming lots of vegetables in their diets is a good thing. Ecological reasons, religious reasons, ethical reasons, concern over food safety, numerous different benefits can occur. There have been some research that shows that vegetarianism can lower the intake of fat and total energy, lower blood pressure, reduce the risk of heart disease, reduce the risk of some types of cancer, and some people have experienced fewer digestive problems. There are, however, challenges with being just vegetarian. The problem is that some vegetarian diets can be low in vitamins and minerals, and vegetarians have the challenging task of finding a balanced and adequate diet in their lives. Soy products serve as an excellent source of proteins, and vegetarians should include complementary proteins in their diets. Vegetarians also should use vegetarian food pyramid to design their diets. Okay, can you eat too much protein? Now, most people don't, but there is, of course, that chance that you may be too high in protein. And the risk of too many dietary protein may include high cholesterol and heart disease. High diets in protein from animal sources are associated with higher cholesterol levels and possibly bone loss as well. High protein diets may also cause excessive calcium excretion, leading to bone loss. The name of the game is, with proteins, it's a balance. You don't want to be too much, you don't want to be too little, you want to be just right. So also, the risk of heart disease is kidney disease as well. And high protein diets are associated with the risk of kidney disease, especially with people who may be susceptible to kidney disease. Protein energy malnutrition is a disorder caused by inadequate takes of protein and energy. There's two common ones which are serious. We don't usually see them in the United States, but it has occurred in other nations. Sorry for that little pop-up there. Marasmus is a disease resulting from severely inadequate intakes of protein, energy, and other nutrients. Marasmus symptoms include severe wasting of muscle tissue, stunted physical growth, stunted brain development, and anemia. Kwashiorkor is a disease resulting in extreme low protein intake. Some weight loss and muscle wasting occurs, edema resulting in distension in belly, retarded growth and development. Kwashiorkor is often seen in children in mainly developing countries. So your chapter talks about in-depth vitamins and minerals. I'm not going to go into it in this lecture, but make sure you read up on your macronutrients versus your micronutrients and be ready to discuss that in your projects.